For preoperative sizing, Cygnus offers templates for various imaging modalities that can assist with planning. The patient is placed supine in a position analogous to that used for an anterior cervical decompression and fusion. Expose the affected level through an anterior approach using the standard Smith & Robinson technique, preferably with a Xerxes cervical retractor. The vertical midline is determined by the orientation pin under AP radiographic control. The distraction pins are inserted in the cranial and caudal vertebral bodies of the affected segment in line with the orientation pin. For the entire implantation procedure, they serve as a reference. Careful decompression of the nerve roots and/or the spinal canal is completed by the total removal of the disc material and other impinging structures. The upper and lower end plates of the adjacent vertebral bodies are carefully flattened to ensure they are parallel. The affected disc space can be restored to the desired height with the distractor. The footprint template is employed to define the appropriate implant size. It is introduced symmetrically about the midline into the intervertebral space and placed onto the end plate of the inferior vertebra about 1 to 2 mm anterior to the posterior border of the vertebral body. A footprint should be selected that covers the vertebral body end plate as much as possible to minimize the risk of fusion. This may necessitate minor resection of the medial borders of the uncinate processes. Color coding is used to select the appropriate trials in the next step. The trials are used to determine the height of the appropriate ROTAIO disc prosthesis. Their geometry corresponds exactly to the dimensions of the actual prosthesis, excluding teeth fixation. The trial implant must be securely seated in the intervertebral space. If the trial implant is loose or can be removed, the next larger height must be selected. The trial implant must lie flat on the vertebral end plates. Eventually, the end plates must be prepared further to ensure that they are parallel. The ROTAIO disc prosthesis is delivered pre-mounted on the inserter adapter. According to the sizing, the appropriate implant is introduced symmetrically about the vertical midline in the intervertebral space until the optimal position about 1 to 2 mm anterior to the posterior border of the vertebral body is achieved. The positioner can be employed in the final positioning of the ROTAIO disc prosthesis. The prosthesis can now be compressed manually using the distraction pins to optimize the anchorage of the teeth in the upper and lower end plates. A final check should be carried out before closure. The ROTAIO is positioned on the anterior midline and is 1 to 2 mm anterior to the posterior border of the vertebral body. The implant is seated correctly in the intervertebral space and is lying flat on the vertebral body. If these criteria are met, the incision may be closed in a conventional manner.